Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on the topic of rosacea. Rosacea is one of the common conditions, especially in males. It occurs from the age of 30 years to 50 years. Basically, this is a chronic inflammatory condition of a skin where it causes a redness of the skin, especially in males. When we look into signs and symptoms of the disease, first one is telangiectasia. Telangiectasia is enlargement of veins on the face. Basically, what happens there is the veins will be enlarged and it looks like spider web. These are also called spider web veins. Next one is erythema. Erythema is redness of face. It can be permanent or it can be transient. Transient means it stays for some time and it goes away. Permanent means it is going to be stick with you continuously. And next one is flushing. Flushing is when you are excited, so your face becomes red. This is called flushing. This is mostly seen in younger age group. Erythema is seen in older age groups, and also telangiectasia is also seen in older age group. Next one is papules. Papules are the raised elevations on the skin which are less than 5 mm in diameter. So these are also common in rosacea. Next one is pustules. Pustules are raised portions of the skin. These contains pus. They look very close to acne, but acne will have comedones and these will not have comedones. This will be red and painful. Normally, rosacea is episodic. This redness will stay with you for some time and it goes away for after some time. So these are episodic. And coming to the location, they are mainly located on the forehead, on the upper part of the cheeks, and also on the chin. These are bilaterally symmetrical. If there is redness in one side of the face, there is redness in other side of the face. So these are bilaterally symmetrical. Sometimes the patient feels there will be burning sensation, there will be burning type of a pain, there will be tingling sensation, and also there will be stinging sensation and also itching sensation in some cases. In 50 to 70% of rosacea cases, eyes are also involved. What happens here is there will be dryness of eyes, there will be redness of eyes, you will have blurred vision, and also you will be sensitive to light. You cannot tolerate heavy light. There will be blepharitis. Blepharitis means inflammation of your eyelids, and also conjunctivitis. Conjunctivitis, the conjunctiva will become inflamed red. Keratitis, your cornea will be inflamed, and also iritis. Iritis, your iris will be inflamed. These are all parts of the eyes. These get inflamed. Next one is rhinophyma. Rhinophyma is enlargement of nose. This nose becomes red. Sometimes it can be permanent or sometimes it can be transient. This rhinophyma mostly occurs in males. In females, it's very rare. Coming to the investigations, there are no specific lab investigations for this. Mostly the diagnosis is through history and signs and symptoms. Coming to the reasons why this rosacea has occurred, there are three main reasons. First one is genetic. If your father or mother or someone has in your family has rosacea, you are prone to have rosacea in future. The next one is infestation with Domedex mites. Domedex mites are the common mites. Every person in this world have these mites on their skin. These are skin mites. These are small insects that live on our skin. These insects are present in every one of us. But sometimes what happens is their load will increase. They will be present on the skin in abnormal numbers. Those people will have rosacea as well. Next reason is due to infection or gastritis due to Helicobacter pylori. Helicobacter pylori is a bacteria which causes gastritis. The people having gastritis due to Helicobacter pylori are also having rosacea. These are the reasons. And coming to the triggering factors, when you have these causes and something has to trigger your rosacea. Sometimes what happens is people who are going in sun, who are exposed to ultraviolet rays, can get rosacea. Coming to people who use steroids, they can get rosacea. Coming to people who use medication for hypertension or blood pressure, they are prone to get rosacea. Changes in heat and cold within the environment can also trigger rosacea. If you have stress in your life, it can also cause rosacea. Abuse of coffee, if you take more coffee or if you take alcoholic beverages, you are more prone to have rosacea. And also if you are consuming either hot liquids or very cold liquids, you can have rosacea. Spicy foods, if you take higher amounts of spicy food, it can also cause rosacea. Temperature changes in your environment, and also as we said, exposure to ultraviolet rays. Even some patients, when wind blows on their face, they are prone to get rosacea. And coming to the pathology in the sense, what are the changes that occurs in the body of a person who is having rosacea? Basically, this is an autoimmune disorder. Autoimmune disorder means normally when there are foreign cells into our body, like bacteria or any other cell, our immune system has to fight against them. In this case, what happens is our immune system fight against our own cells. So this is autoimmune disorder. Basically, there are some genes involved in vasodilation. Basically, the defect in those genes or triggering of those genes will cause vasodilation. This is because of two reasons. One is there can be higher number of receptors that are responsible for vasodilation or overexcitation of the receptors within the blood vessels. These two conditions can cause rosacea. Yeah, coming to subtypes of rosacea, first one is erythematous telangiectatic. In this, what happens is there will be erythema, whether it can be transient or permanent erythema due to dilatation of blood vessels on the face. You can see spider web like structure on the face, and also you can see flushing in this case. Next one is papulopustular. In this, what happens is there will be pus filled lesions on the skin. These are normally similar to acne, but the only difference is acne will have comedones and these will not have comedones. That is the only difference. Coming to the phyomatous variant, in this what happens is your nose gets enlarged. It can be either permanent or it can be transient, and also your nose gets reddish. Coming to the next variety, that is ocular variety. In this, your eyelids are inflamed, cornea is inflamed, iris is inflamed, or your conjunctiva is inflamed. You will have more eye symptoms. Normally what happens is every person who is suffering from rosacea will have one or more combinations of these subvariants. It is never one person have only one variant within this. It is combination or multiple combinations of these variations. Coming to the conventional treatment means the treatment which will be given to you when you go to a dermatologist or a doctor who is nearby your home. This is also called English medicine or conventional medicine or allopathic way of treatment. They do not have any permanent cure for rosacea. Normally they will treat you with antibiotics or antiprotozoals or antiparasites and also steroids. This will have lot of side effects. This will cause permanent damage to your skin or it will reduce the immunity. So you know that there are a lot of side effects with this treatment. And when you have permanent rhinophyma, the only cure for permanent rhinophyma in allopathic treatment is surgery. Coming to homeopathic treatment for rosacea, there is excellent treatment with few lifestyle modification and regular use of homeopathic treatment. You have very high chance to cure your rosacea without any side effects. Here we will give two type of treatment. One is local treatment and also one is constitutional treatment. Constitutional treatment means based on your psychology, based on your physiology, based on your physical structure. So we will take all symptoms in these three planes and we will give you a medicine. This medicine is especially tailored to you. It is specific for you. It depends on your genetics. It depends on your external factors. And when we give such type of medicine, you have high chance that your rosacea will be cured. Apart from this, you know that there are many reasons and triggering factors for rosacea. It can be due to alcohol. It can be due to exposure to cold and hot. It can be due to overconsumption of alcohol. It can be due to blowing of wind on your face. Based on this specific reason, we have specific drugs in homeopathy which can cure your disease permanently. So finally, homeopathy doesn't have side effects. Homeopathy is very effective compared to any other treatment. You have high chance of getting treated for rosacea in homeopathy. Homeopathy is affordable can compare to any other treatment. Homeopathy is safe, effective and affordable. Homeopathy can prevent rosacea that if it is going to be occurred in future. It can cure the existing rosacea. When the cure is not possible, it will reduce your symptoms without any side effect. These are all possible in homeopathy. Coming to precautions, the first precaution you have to take is have very good diet. You should not be taking more carbohydrate or you should not be taking more fatty foods. Apart from that, you should be having very good sleep. 7 to 9 hours of sleep is recommended. Exercise is going to help you, and also leading a stress-free life is very important for curing rosacea. And also coming to specific precautions you have to take for rosacea, first one is avoid direct sunlight onto your face, minimize the use of steroids or try to stop the use of steroids. If you are under medication for hypertension, so identify the medicines that are causing rosacea and take alternatives for it. Don't expose yourself to either high heat or high cold, and also avoid alcohol, avoid spicy food, avoid changes in the temperature. And also when your rosacea is triggered, when the wind is blowing onto your face, stop going on a windy day. And coming to the prognosis, what happens if you don't take homeopathic treatment for rosacea? Rhinophyma is permanent enlargement of your nose. Once the nose is enlarged and it is permanent, you have to go for the surgery. And also your rosacea will become permanent. It can also damage the facial skin. So when you have recently detected you have rhinophyma, come to us immediately. Or if you having long standing rhinophyma, we can treat it very effectively with at Fidicus Homeopathy. Fidicus Homeopathy, you can take two types of consultation. You can either come to our clinic directly in a physical location, or you can take online treatment. The case will be taken over a phone, either in video call or audio call, and the medicines will be sent to your doorsteps. So there is excellent cure. Don't miss this opportunity and don't land into taking unnecessary medication and don't land into complications by taking other forms of medicine. Thank you.